getting a very hands-on experience, or a very, I'd say, unique experience. So this session is by Elaine and myself, and it's really to introduce this new tool that we're developing. We are still in the development process, so what we're sharing today or going through is, it's actually all kind of a pre-beta version. We'll be finalising it in the next month. So I think the caveat to start with is, don't expect a final polished product. The final version will be quite different in terms of how it looks, and then there'll be some extra functions added to it. But we really look forward to working you through the process today. I think, just to acknowledge our funders, it's an Amana project that we're finishing up now. What we want to do today is really get people to the point where they understand a little bit about what this tool is and what it's intended to help with. So the sort of decisions that it's meant to be supporting, and the sort of decision makers that it can support as well. We'd then like to work through the inputs that are needed for the tools and the sort of analysis that it does, and then what comes out of the tool and how you could use it. An important part of the tool is to really examine trade-offs between different options that you might have in your decision, so looking at some of those. And then, of course, really, as we're still in the development stage of this tool, this is very early for us. We're really excited to have a group here of people with very different backgrounds to discuss how they think they could use this tool. And there might be some ideas that we already have that are validated. There might be some ideas that we haven't even thought of yet. So we'd really like it to be a very interactive, discussion-based session, hence why we're very happy that it's nice and small. So before we get into that, I thought I would briefly introduce ourselves and then everybody here, but maybe give a bit more of a rundown on what the tool is. I don't know if the description was very clear, but does anyone other than Phil have much of an idea of what the tool Agri-food is that we're talking about? Or is it black box? Okay, so it's a modelling tool. It's one that we've, as I've said, just been developing, and it's really about looking at how you could inform decisions about what foods to promote for production or consumption in nutrition-sensitive agriculture programs. It's meant to be quite user-friendly. It's not meant to take a year to do the analysis and need very complicated data inputs. And it's meant to be able to be used with very different stakeholders who have different opinions, and help to make decisions when you have very different criteria that sometimes conflicts with each other, and often different stakeholders that might have very different ideas of what's the most important thing in a project or in a selection of foods, such as the sort of disconnect that sometimes comes from having ag people and nutrition people wanting very different priorities. So on to introductions. My name is Frances. I am based between London School of Hygiene and Tropical Medicine and World Food Programme in Rome. So I live in Rome, I go back to London very often and sleep in Elaine's spare room because she's very generous. And this is a research project that we started officially in 2016, 17? 18? It's been in the pipeline for a while. So Elaine will introduce herself, but Elaine is the mastermind behind the Opti-Food tool, which is all about diet modelling. After working with that together for quite a few years, one of the things we were really interested in was whether you could bring agricultural data or constraints also into this diet modelling tool. We initially thought that we could adapt Opti-Food for that purpose, but then realised we needed a whole different tool to do so. So that is what brings Elaine and I together, and the work that we've been doing for the last few years. So maybe Elaine, if you want to introduce yourself, and then we can go to the group.
No, I'm Elaine Ferguson, and I work at the London School of Hygiene and Tropical Medicine, and I guess I've been involved with diet modelling for 10-15 years. I'm probably best known for the Agri-food tool. And this tool is quite different, and it's it's a very interesting approach because it's using sort of more of a participatory approach as opposed to optimization.
So maybe we could go around the room. I think we will be quite intimate today, so it's nice if everyone has an idea of who the other people are. So if you could introduce yourself, maybe where you're working and what you're working on, that would be great. I'm going to start with you first, on the spot.
So I'm Phil. I'm also working at the London School of Hygiene and Tropical Medicine. I'm a postdoc research fellow, and I've come to this because I've been I'm trying to use Opti-Food to design behaviour change strategy for a trial. I'm interested to see what this new tool adds and how I can use it in the future.
Hi, I'm Dom. I am a PhD student at SOAS, and I'm using Agri-food. Elaine is supervising my PhD project, and I work really with forests and palm oil and things in Indonesia, linked to nutrition. And yeah, this is
Hi, my name is Jocelyn. I'm a PhD student at Cornell University, and I am studying, I'm working to develop metrics for measuring food loss of perishable vegetables in India. So I have project sites here in Hyderabad and also in Andhra Pradesh.
Hi, I'm Ikuku Nampudi, and I'm also a PhD candidate at Cornell, and I'm working on gender and maternal and child nutrition and tanzania.
Hello everyone, my name is Ritesh and I'm working with Digital Green in a project funded by USAID, that is Samvad project, and my background is of agriculture, so I'm quite interested to know about this tool. How could we relate agri and nutrition together?
Okay. I'm Celine Turmoto. I'm the country representative for Kenya for Biodiversity International. I do research around the links between agri-biodiversity and nutrition. I've been using cost of diet tool. The presentation I'm going to make on Friday is about a student that had used Opti-Food tool, and I'm very curious about what this tool has to offer because I usually like working a lot with the communities and participatory work.
Hello everyone, I'm Ankita Motal. I am pursuing my PhD at the National Institute of Nutrition in Hyderabad. I am working with women farmers trying to improve their dietary diversity, particularly during the lean seasons through agricultural tool, which is a solar dryer. So I'm looking forward to using tools like this.
Hello everyone, my name is Subhi Parekh. I'm a research fellow in Maharaja Sayaji Rao University, Hyderabad, Gujarat, India. And my topic of research is how assessing food and nutrition security in one of the aspirational district in Gujarat. And I want to know about the agriculture food tools so I can use in my study, because food and nutrition security cannot be assessed without no agriculture. So I want to.
Hi, my name is Priyanka, and I work as a nutrition expert in IPA Global, Delhi. And I work for a project called WeCan, which is a Bill and Melinda Gates Foundation funded project. So my background has been masters in public health nutrition, as well as I am a diploma in public health management. After that, I worked in field related to maternal and child health and food fortification programs in India. With the recent flagship program that Government of India has launched, that is the Poshan Abhiyan or the National Nutrition Mission, finally, we've realized, even at the national level, that, nutrition cannot go without really getting into the interdepartmental or, looking into the sensitive aspect, and then the nutrition comes in. So the project that I work for is about like a collaborating center for all the partners who are doing different work and kind of telling them to cross-learn from each other. So there are partners who are working on agri-nutrition in their own bits and capacities, and we are trying to kind of, take all their learnings together and kind of go to Government of India and say that, we can do this for this. For this, because I really don't know, being a nutrition person, how to really kind of collate the knowledge that they have and take it further to the government. So I was looking forward that, how this tool can be really relevant and useful.
My name is Johanna. I'm a veterinarian. I am also a research analyst with Chatham House, working on a Bill and Melinda Gates funded project on livestock and agriculture policy. And I'm also a PhD student at the University of Sydney, where I have been studying diets and nutrition for mothers and children, and the relationship with village chicken production. And part of that project is I was looking at seasonal availability of different foods, and so I have a lot of data on what is produced and what is available in three different seasons across 3 different villages or areas, and I wanted to see how I could optimize that data and get something useful out of it.
Yes, my name is Josiah. I
my background is in agricultural economics, but with research interests in food and nutrition. My interest in this is part of a project that is seeking to transform potato is a key step in Kenya into a nutrition sensitive value chain. So I would be interested to see how, if at all, these two support in that direction.
Great, thank you very much, everybody. I know that that's always the obligatory part of workshops, but as a facilitator, it's really interesting to know where everybody's from and to be able to, I guess, tailor it a little bit more to what you're working on. My ears have already started pricking up because we're still at the point where we're really interested in who this tool could be useful for, and I think there's some really good examples here. So my plan was to give a bit of a background to the project and why this modelling tool has come about, and then walk you through how the modelling tool works, and then we'll get into the workshop component just before lunch when you'll be making some decisions and doing some criteria weightings, and then when we come back from lunch we'll be putting that into the software and see sort of what impact it has on the results. So as a bit of a background, I think just to be very clear, what we're talking about here is, as a starting point, is diets. We're nutritionists, so it makes sense for us, but we often feel we have to make this very clear and make the point for other people that diets are this sort of factor that underpin all forms of malnutrition. And in order to have nutritious diets, you need to consume nutritious food, a diversity of nutritious food, and it needs to be good quality. There's a number of different factors that impact whether nutritious diets can be consumed. So we're talking about availability, physical access, affordability, desirability, whether people actually want to eat those particular foods, and whether these foods are convenient. And I think that, just as Priyanka was saying, this needs really different interventions or actions across possibly very different sectors. So sometimes we see projects or interventions that just target one of these factors. So maybe this is an agricultural intervention. Sometimes we see something just about affordability. This could be ag or markets, anything really. Maybe there's BCC around desirability, or maybe there's a cross-cutting intervention that comes across all of these. We've been trying to think, how could we have a tool that is relevant to one or many of these sort of different types of interventions. Zooming into the particular part of nutrition-sensitive agriculture, which is why we're all here, we've started learning with all of these different reviews of nutrition-sensitive agricultural interventions that have come out in the last few years that there is evidence that they can have an impact on diets. Whether they can have a really strong impact across all areas of stunting or other elements is still to be proven, but diets is one of the areas where there is really strong evidence, and I think what's really important is that it's not just improving the diets of individual target groups like lactating women or children under 2, often it improves the diets of the whole household. So there really is a strong argument to be made for improving the possibility of improving diets here. That effect on diets is a lot larger when a behaviour change component is involved in these projects. So if a nutrition-sensitive project also includes some element of nutrition behaviour change, there is a bigger impact on diet quality and diversity. Within this, sort of these agriculture nutrition interventions, often, not all of them, but many of them focus on promoting particular foods or food combinations, either to consume or to produce or both. So there is an element with, sort of trickling down with many of these projects where they do have to, at some point, make a decision as to what they want to promote or what combination. And that's really what we're talking about for this particular tool. That particular selection of foods to promote can get a little bit complicated when you're trying to take different criteria into account. For example, if you just wanted to pick the most nutritious combination of foods, that's quite easy. You could look at the nutritional values and do a quick calculation and work them out. But if you want to take other things into account, it gets more complicated. So for example, if you have an agriculture program or a nutrition BCC program and you want to select the best combination of foods, if you take into account nutrition goals when you're designing this agricultural program and selecting your combination of foods, you could make that agriculture program more nutrition sensitive. We also realise that that goes the other way. And this comes, our background as nutritionists, we're always told, it's nice that you're picking the most I guess, nutritious foods, but also you need to take the agricultural context into account. So what we're trying to sort of get to there as well is that there's also a need for nutritionists to consider agriculture and make the selection of foods more sensitive to either the nutrition situation or also to include some agricultural goals. If this was the whole picture, it might be a little bit easier, but we've also realised in the work we've been doing that there might be environmental considerations or goals, gender, food safety, a very important aspect, biodiversity. There's many others that you could list here, but what we're really trying to get to is that if you're trying to select this combination of foods, there are many elements that come into it. There are not any tools currently that are able to really help with this selection of foods. There are a lot of guides. This is a sort of mock-up of one that some of the different guides that the World Vegetable Centre and IFAD and Helen Keller have. They list different things that should be considered when you're developing this sort of tool. Am I blocking anyone, by the way, on this side? Great. So, for example, they start with this, broad introduction of, review the nutritional gaps and what is the potential nutritional value of the crops that you're selecting between, or garden foods that you're selecting between. But then they also ask people to look at local considerations. How much land is available? What's the soil quality? Are there pests? How many seeds do you have available? And then go into characteristics of the particular crops. Do they need fertilizer? What is the expected yield? And even then go into which ones will have more or less impact on women's workload. So this is very, very fantastic that these guides exist and consider all of these elements, but it still is down to the decision makers to think through all of these elements and then try and choose one combination that optimizes across as many of these as possible. That could be done, but it is a little bit complicated when you then have to do that with maybe 3 different interest groups. And try and think about, if you select one thing, what impact might that have on another criteria. So if you're optimizing for one criteria, is there a trade-off for another criteria? I mean, I think an example might be if you're promoting a certain, maybe if you're promoting groundnuts, would that mean that women do the bulk of that work and therefore there's no time for breastfeeding? It's a very simple example, but they're the sort of things we're thinking of being able to trade off with. Or if you suddenly start promoting green leafy vegetables, which as nutritionists we always want to promote, does that have big implications for water use? And it might mean then that means you don't choose that particular food to promote, or it identifies something else that has to be a component of your project and a way to address it. So what we're really wanting to aim at here is a way to identify trade-offs and be able to look at the impact they have for different decisions. So in terms of how we got to being able to develop this model, there were 3 activities that we did first. We did a review of decision priorities that have been looked at in current projects. Then we did a lot of qualitative research, and then we did a review of similar tools to find out what sort of elements they have that make them useful. So I'll run through a couple of results because they really help to understand a little bit of the components of the tool. So in terms of the first element, it was really to look at, of all of these, I mean, there's many, many nutrition-sensitive agriculture programs that have been designed and implemented and evaluated. Of all of the, I guess, information that's out there and published, what sort of nutrition-sensitive agriculture programs have been implemented and evaluated? What were their main components? Was selecting a combination of food relevant to them? And if so, how did they make this selection and who made the decision and what sort of elements were important for these decisions? So we identified about 61 interventions, and if anyone's very interested in the particular results, we can share them. This is a very quick overview. But we found that for almost all of them, the selection of a particular food or food combination was relevant. In a way, I think the most common one was selecting a group of foods to promote for consumption or production. But there were also other elements such as picking a particular variety for a local context. So orange flesh sweet potato was one example of this. They have thousands of varieties of orange flesh sweet potato, and some are optimized for pest control or drought, but might also have a flow-on effect to vitamin A content or how much water is needed. So, being able to pick what is the actual best product for your local community based on also community preferences and soil conditions. And then the last decision where this, the selection of foods was quite important was also if there was a big intervention going on, so for example a maize project or a dairy project, picking some other foods to promote that would complement that. So whether it's complementary vegetable gardens or intercropping or whatever it might be, there was also this sort of decision going on. There were a lot of different criteria that were mentioned for these sort of decisions, and many of them were not in agreement. I think, as I said, optimising for one might mean having trade-offs for the other. But I think that was really interesting to see, especially depending on the main goal of the project, if yield was their principal aim, but they also wanted to increase nutrition, or if nutrition was their principal aim, but they wanted high yield, so there was more of the nutritious foods. It was interesting to see what was more important there. And many stakeholders were involved in this process. We thought initially that maybe it would be a decision that was just made by the program implementers, but in many cases there was a process of either having the community make the decision or having at least a focus group sort of process with communities or with other projects in the area to really find out what was important for them and include that process in the decision making. So there was a preference for doing this in a more participatory way. So that's what we found out from that review, and that led us then to do a much more in-depth, analysis of this with people working in the area. It was really nice to be able to look at the literature that existed out there, but most of the studies that are published are about evaluations and mainly impact evaluations. There were only a few process evaluations and very few documents that we could access that describe the design of a project. So we really wanted to go to people who are working in this area and ask them what is relevant when you're designing a project, who makes the decisions, what criteria are considered and which ones are not. So we talked to many different informants who, people from academia, people from programs, people from donors, people who work in, many different fields around the world. I think there was 63, I haven't got the number there, to really ask about their experience in designing nutrition-sensitive agriculture programs, and as I said, who makes the decisions, what they consider, and how they go through this decision process. And then we really tried to break down the analysis to identify decisions, decision makers, and decision criteria. So the key findings for the nutritionists, or anyone who was sort of from the nutrition programmer side, I'm going to just refer to them as nutrition programmers through the session, their diet quality or nutrient amount was their key priority. This was not the case for as many agriculture programmers. They were really interested in yield and income. And they really spoke about this in, we do want to be sensitive to nutrition, but that does not mean changing our program completely. These two elements will always be our main priorities. And that might change, but it was really important to know that these goals can't just be swept under the table, they still need to be respected. There were many other priorities or criteria that came in as well, and they were mapped and identified through this process. There was a lot of overlap between decision makers, so it didn't just mean that nutritionists only cared about nutrition and ag people only cared about ag. There was a lot of overlap, and we tried to capture that in. I won't share it today, but there's a big, kind of very messy conceptual framework we had to try and break that apart and understand where there was overlap. What was really interesting was that there were very few tools or processes that were mentioned to go through this selection process. I mean, it ranged from we consulted with experts to we took a list of all of the possible vegetables and pressed sort on vitamin A content and took the first 5. I'm not kidding, that was a big international project. So, and then also in some cases it was, well, the government or USAID, they prioritise the crops and we have to go with that. So there were many areas where possibly there's not a change that's, that they really have to keep going with the government priority, and others where they said we would like to improve how we're doing this, but we don't have a lot of time and it can't be an analysis that takes 6 months or needs a lot of primary data collection. So there was definitely interest in using a support tool if it was something rapid. kind of briefly to go through this is a real breakdown, I guess a summary of the decisions that were identified by those decision makers. The nutrition programmers did talk about, I guess, identifying combinations of food to promote the consumption or to develop recommendations of foods that would complement an agricultural program. So these were the sort of key decisions that nutritionists were involved in when sort of having to select combinations of food. Some of these were also relevant to agricultural programmers. They wanted to incorporate some behaviour change into their agricultural program, or they wanted to select the particular crop or foods that they were going to be promoting for production or supporting, either within a new project or an ongoing project. Often it was about that particular variety selection I was saying, and really about, you know, understanding that it was not just about grow these foods. Often there was an element of also eat them, or grow this main food, but when you're doing that you should also have these other foods included. There was a little bit of discussion about people who are growing the food themselves and what their decisions might be, and there were a few projects out there that had, you know, that group as the decision maker, and they were really interested either in what should we grow, more often as a community group as opposed to individual people, or being consulted in terms of what should be included in this project that's happening in your community. We identified many criteria. So when we refer to criteria, it's sort of priorities or goals for making this selection. We started with a very long list. We then sorted it into these sort of main headings. And we eventually were able to boil it down to 25. We had to choose I guess a number at the time, but this is relatively flexible. It's not a closed list. It means that we could add more criteria to the analysis that goes on. The reason that we had to kind of decide on this is that we had to, for each criteria, then work out what the data input would be and how it would be treated in the program. So I guess the main one that is a no-brainer is nutritional adequacy of diets that include these foods, or nutritional content of different foods. Anything to do with access, so this could include access to getting the food or the inputs to grow food, or how the quality of inputs that are available locally. For each one of these headings, there were maybe 5 criteria initially. Labour and time use, especially disaggregating that by gender. Women's empowerment, so whether particular crops were more linked with women's decision making or women's income, whether different crops had more likelihood of greater yields or income impact, suitability for the local environment, so water needs, resilience to temperature, risk of how resilient different crops were to drought or flooding or pests, for example. Also, seasonality was a big aspect, so whether a food would be only available for 2 months, whether it grew across the year, or whether there would be something like solar drying that you could implement so that it had a longer lasting ability to provide nutrients across the year. The elements that we've explored them, but we're not yet at a point where we've included them in the model, but we're interested, I think we're going on to a possible project where we're really interested in looking at both indicators of biodiversity, but also environmental impact, so what particular crops would do to the soil compared to others, or other elements, water table. We're not at a point where we really want to talk about them too much because we haven't looked into them in as much depth. But as I said, this is the software is going to be open enough to be able to add more criteria. And then the last thing we did in the preparation stage was to look at tools that are already out there to support some of those decisions or decision makers that I mentioned. As I said, there was no tool that already existed to be able to make all of these decisions or include all of those stakeholders, but there were a few out there that could be used by one of these groups. So we found that there were about 7 tools that we identified that could support agricultural programmers to be able to select foods to produce. There were 4 particular nutrition tools to select foods to promote for consumption. And then there were some different tools out there to inform smallholders about what foods to produce or which seeds to select. Some of them are very simple apps or a website where you sort of say which part of Kenya you live in and then what seeds you're interested in and what your rains are like that year. But they were still interesting to look at in terms of what the pros and cons were of these different tools. As I said, there were no tools that compared trade-offs. So if you picked one particular combination, which of your criteria would look good and which of them would not look so good, and so what might help to adjust your decision there as to what you choose. There were features that were identified that made these tools very positive. I don't think this surprises anybody, but really anything that was faster and easier to use was favoured. Definitely data inputs and outputs that were easy to get your hands on, but also then to understand. And the ability to tailor the modelling to a local context, so not a general result, especially when we're talking about agriculture, because the local conditions might be very different in different parts, even of a region, not just a country or a whole world. And then the last bit that was really prioritised was letting sort of some aspect where stakeholders were not only included, but their knowledge was also taken on board. There was a really interesting tool that was for picking trees, or I guess it was an agroforestry tool to pick trees to complement coffee crops. It was quite qualitative, but one element was to use local knowledge of the different tree crops, and that was seen as quite a bonus in getting the information where data sources did not exist, but also getting people really involved in the analysis and not just coming to them with the results and saying these are the best trees for your coffee crop. So it was something that we really looked at as well. Once again, I don't think these will surprise anyone, but any discouraging features were, lots of time or resources needed to collect data or do the analysis. Being able to actually access tools. There was one beautiful one, but it was only available in CD-ROM, and I don't know if anyone has CD-ROM anymore, or some sort of out-of-date software formats now. So being able to have something that was quite accessible and simple was our goal at the end. So what we've developed is what we hope at the end will be quite a simple tool, and it's a web-based application that's meant to work with very low internet. And I think one thing that we often, when we tell people it's web-based, they say, well, I've just spent 2 weeks in rural Malawi and I haven't even been able to check my WhatsApp. The whole idea of this as well is that you could do the inputs for it offline, go back if you had to, where you have Wi-Fi, put them in and then come back with the outputs. It wouldn't have to be real time in the same way. Are there any questions or comments at that point before we get into the actual model? I've been speaking a lot and we do really want it to be interactive.
Yeah, one question. When you're talking about developing the environmental sustainability or impact, are you taking into consideration different production systems as well?
Yeah, we want to. There's a project that we're hoping to link into that I think will really be analysing first what they're doing and then how it's a project where I think this will accompany what they're doing and help to have them select the foods they're going to produce, but the whole project is about production systems for smallholders. So we're still working out exactly what the criteria and then data inputs would be, but we are keen on looking at that as well. Yeah. Any others? Okay. So MCDA, I don't know if people are new to that acronym. It was new to me up until a couple of years ago. Means multi-criteria decision analysis. So we thought I'll just briefly run you through what that entails, so that you can hopefully get a hang on how the model works. I came from a background of optimization and linear programming. In comparison, MCDA is incredibly simple. It's really, really, really easy to understand and apply. So it's a very simple method for complex decisions. It's being used, in government decision making, in environmental health, in health systems, we've found many, many examples of it in town planning all across the world. The UK government has a whole, department that works just on MCDA for decision making. So it's quite it's not new. but it does help when there's complex decisions. And it compares the options for a decision across conflicting criteria and across obviously multiple conflicting criteria. So when I talk about options, in our case, it's which foods or food combinations would you like to promote? All of those individual food combinations are different options, and the criteria might be things like nutrition, quality, yield, impact on women's work time, for example. One really nice thing about MCDA is that it considers the way that stakeholders place value on these different criteria, and you can consider individual stakeholders or stakeholder groups one at a time, but also then the whole stakeholder groups. So it is a really nice, I guess, engagement tool in that way, because you can then use this to say, okay, well, these are the results if we just take the views of this table here, these are the results for this table. Now what if we take everybody's together, how much do the results change, and using that as I guess, an entry point for your discussion. And what it gives as an outcome is a ranked list of all of your options with the scores for each of your criteria. So you can use that to then look at what are the actual, if I've got the first, second and third options that are coming up, what are they scoring really well in and what are they scoring not so well in? And therefore, what might I need to either toggle around or think about when I'm planning my intervention. So as I said before, you might have something that's coming up as positive of 6 out of your 10 criteria, but there might be 3 that are quite low scoring. So either you say, well, that's not appropriate because it really has to be high scoring on water, otherwise people can't grow it in this particular area, or then we need to think about that other element when we're implementing a project. There is then an option to do a lot of, sensitivity testing with your decision or with your options. We're not planning this at all as a tool that spits out an answer, unfortunately. It's more of a tool that you use to help, especially in a group, make decisions. And this, ability to see how the results would change if the stakeholder weightings changed, if you didn't use any weightings, if you then added a new food, or you weren't quite sure about the score that you put in for eggs and women's time, if you then change that score, you can see how the results would change in real time, so that you can start to really be sure about your results and then apply them to your decision making. So that's the last step, where you really compare the trade-offs between the different options and help to inform your decision. So Agri-food, the tool that we've developed, is an MCDA tool. It's really about selecting foods or food combinations, probably more food combinations, to promote for production and or consumption. For really, at this point, we've only really thought about the smallholder agriculture side. Whether we think more about bigger agriculture in the future, I think depends on how this is received. But it's really about thinking about interventions, what sort of combinations of foods to include in them. At the moment, we've identified 3 decision maker groups. Agriculture programmers, nutrition programmers, these are people that could apply the tool. Smallholder farmers, we definitely, I've got it in blue there because we're not at a point where we're expecting smallholder farmers to pick up the tool and run it themselves, but through a facilitated process with these groups, we'd like to also have them as a decision maker group. So the actual steps of Agri-food are first to determine what the context of your decision is and what your decision is going to be and who might be involved in that. So a good example would be if you are in Timor-Leste and planning a chicken project with home gardens as well. What is your decision? We'd like to maybe first of all know, should we also include fish ponds? What sort of vegetables should we include with this? What is the best kind of mix of elements that should be in this home garden or homestead food production model? Whether then you also start to think about stakeholders. So I'm thinking in Timor-Leste, you've got the Ministry of Agriculture, you've got possibly your donor, and maybe also your own program, Ministry of Health, and then ideally an organisation representing the community or the communities that you're working with. So they might be the stakeholders that you start mapping this out over. You then define what the objectives are for your decision. hopefully with those stakeholders. So it's not something that you sit at your desk and think about. It's hopefully a process that you go through together and think, well, first of all, this is a nutrition project, so we want to be able to improve the nutrition probably of a key target groups in the community, but then you also want to do something that people are likely to take up. So it has to be acceptable, it has to be something that they see other benefits from, so maybe some yield and income criteria, something that doesn't have harmful effects on women's time, something that's suitable for growing in the local area, for example. So you define those objectives, and then from that list of criteria, select the ones that match those objectives. Then those different stakeholder groups rank those criteria in order of what is more important to them. So that's something that can be done in small workshops, individually, or in a big workshop. And there's also a process where all of the stakeholders come together and develop a sort of an overall ranking of criteria, weighting of criteria. The next step is to identify your options that could achieve your decision objectives. Now, we have to start off somewhere when we're modelling these diets, so we start off by identifying the sort of foods that maybe are possible to include. So it could be a range of vegetables and animal products, it could be maybe different varieties of a very similar food, or you could do different rounds of analysis. If you maybe start with, we're going to do with generic green leafy vegetables and compare them to fruits at the beginning, and then as you go down, then now say, well, we have to only buy one seed variety, so let's choose which green leafy vegetable we really want. What Agri-food then does is to combine every possible combination of all of these foods that you put in. So, maybe you start with one with sweet potato and papaya, sweet potato, papaya and eggs, for example. Because we're diet modelers, we also, under the hood there, include a certain element of the local staple food, so that in every case, a whole diet is modelled. So we always have an energy replete diet. So it's looking at sort of the context of adding this food to a diet that meets energy requirements. You then, this is the easy bit of agri-food that I was mentioning. For each of these individual foods, you enter your scores for every criteria. So the nutritional adequacy one is very easy because the software will calculate it. But for all of the other foods, you need to be able to provide a score. So the reason we have this list of 25 criteria at the moment is that we had to develop some method for being able to score that. So if it's water, how much water this particular food needs, it's a relative scale based on whether it's very high or very low, and whether you have good data from the seed supplier, or whether you need to use sort of local estimates. So you enter those scores for every single criteria for all of the individual foods, and then the software will do a combined score based on a combination, using either a weighted average or taking the lowest score from that food combination if it's something that would act as a bottleneck to producing that entire combination. So then you multiply each of those scores by how much stakeholders have, weighted that particular criteria. So it's very sort of simple mathematics at this point, and it spits out a number, and that number is used to rank all of the options. You can then play with your ranking to see how sensitive it is to changes in your input. So if I suddenly take Josiah's weightings instead of Johanna's, then would the results change that much? And it is quite interesting to look at there, because in some cases it might mean that if the agronomists had their way, they'd get a very different combination of foods than the nutritionists. Or it could be a really interesting point where we say, well, maybe number 2 and 3 change, or 1 and 2 change, but the ranking's not that different. So it could be a good way to bring people together as well, where before they thought they had a lot more differences. So you'd go through these steps until, people are satisfied that they have the information they need to make a decision. And then hopefully you're going to apply these results to inform your decision making. Are there any questions at that point? We will walk through a couple of examples, and I know it's a lot to take in.
Maybe to start on how you get the stakeholders to assign weights to the different options.
So you're going to do it yourself in about 10 minutes. Yeah, maybe we could do it in that way. I mean, I think.
It's coming.
Yeah. You're actually going to do it yourself, so it would. I think we're also very curious about how as the kind of proxy stakeholders here, how you find the process. I mean, there are many options that we've considered. It really depends on the context, whether it's a place where you can have a nice big meeting all together, whether people sit aside and do it. And there's been many, for all of the, I guess, the different applications of MCDA, there's been many different ways of doing it, from people doing private voting to doing big discussions where they wave their arms and talk a lot. And then we've also been discussing a lot the element of power of the stakeholders. So it might be more appropriate in a big group, just to have everybody discuss. But if people in this room have more or less power, then they're not going to be represented. So how you take that into account when doing this weighting is very important. So I think we've got I guess a method we'll show you today, but there's also other possibilities. And in terms of how it goes into the model, at the moment it's a basic ranking. If there's 9 criteria, you have to put 1 as the most important, 1 as the least important, and all the way through, and then that's taken into the software. So, sorry.
So there were a couple of combination of foods on that list, like 1, 2, 3, 4 previously. Yeah. So this could be anything, right? I mean, it can also be sweet potato and egg.
Yep.
Like it can be
any possible combination.
Possible combination. Not necessarily one gets added or.
Absolutely. Yeah. This was just. I mean, I couldn't put them all on one slide, but there would be hundreds for putting in 5 different foods. Many different possibilities of those iterations. Yeah. So you could look at the results for all groups of 3, all groups of 4, all groups of 5, for example. So I'm going to run through a quick example before we do our own. And this is a simulation of a project in Bangladesh to select, that is going to do homestead food production, and they would like to promote or support people to grow a selection of foods or produce a selection of foods, and they also want to include a behaviour change component where they promote the consumption of these foods. So their decision is, what particular foods do we grow? We spent a lot of time talking to organisations such as Helen Keller and WFP about how they currently make decisions about these, which seed packets, often that's what it comes down to, are delivered. We know that it's not always so easy to decide from a headquarters level, but maybe locally you could make this sort of decision process in there based on what people want to grow, what seeds are available locally, etc. I think what really struck out to us was maybe there's sort of a bit of thinking going into whether they include chickens or fish ponds, but otherwise no one could really tell us, and I don't want to badmouth any particular organisation here. I'd say this is out of many homestead food production organisations we spoke to across the board, nobody could really tell us a particular process that was gone through for selecting foods. Just it was more, well, we know vegetables are good, so we got some local vegetables. So we're really interested to know if this is something that people think there is a need for, to be a bit more thoughtful about how you pick these varieties. So this is the example that we'll go through. In this example, the decision objectives had already been defined. That was used to select from the list of criteria, and 8 criteria was selected to align with the objectives for this decision. So for this particular decision, they wanted a combination of foods that were nutritious, were locally acceptable, people would want to grow them and then eat them, did not require too many inputs, so it wasn't very expensive to go and buy the seeds or the tools or build a chicken coop, for example, would encourage women's control of income. So particular foods might be more likely to be seen as a woman's food and therefore produced by a woman, and the income coming from that food is more likely to be controlled by a woman. That's not always the case, it's a bit of a generalisation, but if there's enough data or if it is considered that way, that can be taken into the model. They wanted varieties or crops that were high yielding, but were also tolerant to likely shocks that might be present in this community, and were more likely to provide access to nutritious foods across the year instead of just one season. So the criteria that went into this particular analysis was the nutrient potential, so the possibility of meeting nutrient requirements, local acceptability, the inputs required, the likelihood of women's control of income, potential of being able to produce high yields, tolerance to local pests, drought tolerance, and seasonal access. When I talk about nutrient potential, we're modelling all of our diets have to meet 100% of energy, but then in addition we look at 11 micronutrients. 13. I get mixed up with cost of food diet. It is
12
with protein. Yeah. So 11 micronutrients and protein. So this is our first group, and so it's very, very small on this screen. That this was those same criteria in the software. The agricultural programmers ranked them from 1 to 8. So the other thing that we're doing at this stage is that we're putting nutrition as the highest priority for all of the analyses across the board while we're doing the testing, just to make sure that that still has a big impact across all aspects. That the other criteria were ranked by the difference by this particular stakeholder group.
Just a minute.
Yeah.
What, for example, the 5 meal.
Yeah.
The first potential for
Here.
that run for weight of 5 meals.
The 5. Sorry.
I'm just seeing like
Potential of achieving nutritional
that's a
adequacy.
weight of.
Yeah, that's a weight of 8. So there's 8 criteria, so 8 would be the most important.
And this is just hypothetical as well. This isn't.
So it means that, I'm really sorry this is so small, it was big when I practiced.
So like in that particular case, the stakeholders.
So in this particular case, I'll read through it. If I do it this way, it's going to be easier. No, come back. And I think the difference thing here to see is that the nutritionists put different things as most important. So they put women's income as much higher, obviously seeing a link between women's ability to have income and then the flow-on effects for nutrition. They put local acceptability of the foods for consumption as higher. They also thought that climate and drought were really important elements, however. And once again, it's a rank. It doesn't mean that if something is number 1, it's not important, but everything has to have its order. In this example as well, this is the smallholders. They put acceptability at number 1, so whether they already are interested in the food and want to eat it. Then number 6, so the second most important was the yield. And then the next one was whether they could access the inputs. So this is, really just an example, but it is interesting to see what are people's priorities, how important are these different things to them. In this example, and I'll just go through this one and then I'll project again, then these stakeholders came together with these values and discussed as a group what would be the sort of the shared weightings for the entire group. So in that case, then the most important one was seasonal access across the year, and then being able to be tolerant to drought and shocks, and then income and yield potential, and local consumption, and that one's twice. But that was sort of what was really seen as being, the representation of the weightings for the whole group. Hopefully this comes up again. Oh, sorry, it looked better last night at 1:30 a.m. Just to sort of give you a very brief overview, when we do the tool in the group, we'll have it projected. But you then, I think one important element to explain is that we model. You model the diet of a particular group. So here we're modeling. Thank you. That's very useful. So we have the ability to model any particular target group that people are interested in. We've chosen in a lot of our analyses 1-year-old breastfeeding children just because of the nutrient density needed for that particular age group. I think our assumption is that if your combination can meet the nutrient requirements of that group, then it's going to be okay for the whole household. In that case, we did think at the beginning. I think Celine, you mentioned you've used cost of diet a lot. We did think about modelling an entire household, but then thought, well, households change so much. At least if we have one reference group, it's a little bit more stable. But there are options to change it, and we're looking at testing how the results change with different groups. So of course then, because you're modelling the diet of a particular group, nutritionists will know you need to set your bioavailability, set the nutrient requirements of this group, etc. All of those nutrient requirements for all possible groups we've already put in the software. So, yeah. So you set it based on what the food availability is in the local area. So and what diets are like. So if you know that in this area diets are mostly plant-based, then the iron bioavailability is probably going to be quite low. So we have for iron, you can either pick between 5, 10, 15, or 5, 10, 15, 20%. No, it's just up to 15. So you'd set that. I mean, if there was an area where they have a lot more meat or other animal source foods in their diet, you'd set it higher, and that would multiply the nutrient information. You then select your foods. I really am sorry about this graphics. But for example here, you have lentils, amaranth leaves, got some bananas, tomato. Let's say in this example they had eggs because they were considering chickens. They also had some carp because they were thinking maybe fish ponds could be a nice example. Some different fruits and vegetables. You also select your local staple food, very similar to cost of the diet. So in this case it was rice. And you make sure that there's a minimum amount of the staple food to include it in every diet, but then any energy gap is made up with that local staple so that the diets are all 100% energy. In this case, because it's a breastfeeding target group, we also include breast milk to make sure that we're modelling a whole diet. You also put in food group constraints that can be, sort of from a population average, or sort of set by I guess a reference, or they can be something that you can play with based on other information about the population. And then you have your evidence matrix. So this is just an example for one criteria. I think I can make it bigger. Actually, I don't want to play with it now because I might lose it. But for example, what you have on the left is every individual food, and then you have the a bar that looks at how then you play with what actual score that you give that food for that criteria. So this is the extent to which foods are already consumed locally. Now that's something that you can get from secondary data quite easily. So you can either put in, we've got scales that are matched to the actual percentage, but you can put it at a certain point in the scale that matches the data you have. Or if you don't know, and if you want to do this analysis a little bit more quickly and want to talk with local experts, you could instead use qualitative information. So particularly in this case, you could do a focus group discussion and have people estimate, is this something that is consumed by some people, consumed by most people, never consumed by everybody, for example. So we've got for every indicator or criteria an option to use qualitative inputs or quantitative inputs.
Can I ask something? So for all the food items, say if you've got a population that's maybe 100 food items,
yeah.
Would you use a program to narrow down your list first and then?
Yeah, so what we're thinking is, initially we saw this as one way to use this would be as a next step to OptiFood. These are the best foods that we identified from OptiFood. So now we'd like to not only pick out the nutritionally best foods, but also pick out those that kind of score highly across many criteria. We did not want to limit this tool to people who could only use OptiFood though, because that's a limited amount of people in the world, and this would limit it even further. So it definitely will not be as precise as OptiFood, but I think another thing to consider is if you already know what the sort of general foods you're thinking about promoting, or that are options to you. You're not going to put beef, maybe beef on there if you know there's no chance we're going to include beef in our program. So same with, you're probably not going to put blueberries, if you're in Bangladesh. So you can start thinking first, going through a process, what are the options we're considering, and then compare them in this program.
And it probably also depends on the decision as well. So this, and so there's a lot of flexibility. And how you can use it too.
Okay, so then this is the first set of results. So what we've done here is we've applied the weightings that have come from that general stakeholder group. So here we've seen that the result that comes out first and the second are very similar. So the first one is a combination of tomato, okra, spinach, amaranth and lentils. The next one instead is tomato, okra, carrot, amaranth and lentils. And then the third one is tomato, okra, carrot, spinach and lentils. So they're quite similar, but it's basically saying this is a combination of those foods that is most, positive across as many criteria as possible. And then we've got the option to sorry about this screen, you'll see the real version after lunch, to zoom into each of those options and see what the individual scores are for each of the criteria. And then I think what is more useful is to export the analysis and actually look across the whole matrix of the criteria. So here, for example, maybe I'll go out of this if it doesn't pick me out, and I've got the actual results. That's a little bit clearer. I'm going to blame it on the projector. So, for example, this is the first result, and what we would do here is look at the differences in the scores. So every column has been ranked to look at, sort of the highest scores would be in more of a green colour, the lowest scores would be in more of a red or a yellow. And what you can see here is that this first combination is scoring very highly, relatively, on whether these foods are locally consumed and people can access inputs and they're available, you can access, some of these products throughout the year. But something that is a little bit more, troubling is women's income. So maybe you might then want to choose another combination that's a little bit higher there, or you could say, well, then we should have a community education component with this particular combination, where we're also really encouraging women to have more financial skills and to take more control here, or really targeting women with our program. Or you might say that, for example, it's scoring very low here on susceptibility to drought. So you might say, well, that combination, these first 9 are completely inappropriate. We would probably only consider things that scored at least this minimum threshold of the drought tolerance. So that would be how you start going at kind of weighing up these trade-offs. As I said, the program is still in development, so we're going to have an interface that does this in a much more easy way without having to go through and create different colored columns, but that's something that's still to come. Going back to this example, then what you can also do in the software is hover over these ratings, or there'll be a separate screen for this, and compare each option to how the option would rank on an analysis with no weightings. So here it's saying that this particular combination, if there were no weightings, it would be 4 points lower. So it's able to sort of see what sort of impact that would have. And then you can put in the weightings from the individual stakeholder groups and see how their results would change. And in this particular group, the number 1 option stayed the same, but from 2 onwards, there was a little bit of difference. So this is another thing to really explore with stakeholders and say, okay, well, your results got this and your results got this. What would you be willing to compromise on? How different are they? How similar are they? So how we would like to use these results is really to first identify those trade-offs and consider them. How important are they? What implications might they have for your program? Does it completely rule out an option, or does it mean that you have to tailor your intervention in a different way? And even, something that I think is not to be discounted is that even just getting programmers to think through some of these steps and some of the implications their combination might have could be really positive. I know that that's a very qualitative thing to say for a modelling program, but just even going through the steps of considering some of these possible implications could be something that was not done before. Then obviously it's selecting what sort of food combinations you might want to promote, and really using this information to weigh some of them up, and then thinking about what might need to be included with these elements. And as I said, this program definitely does not make the decision for you, but it gives you some information and tools to help have those discussions. So very quickly before lunch, we're going to start with the case study. And what you're going to do is be the stakeholders and put some value weights on some criteria, and then after lunch we're going to actually model what the different impact of your ratings are. So our example is a bit of a real life example. We've been doing some really great early work on this model with International Potato Centre in Mozambique. Actually, a really nice thing about this collaboration is that it all came from this conference. So talking with colleagues back in Ethiopia and in Ghana as well when we had the early ANHs. So they have their really, International Potato Centre are known for their orange/sweet potato program, but they wanted to see if there was something they could do to look at other components that could be included. So if they already have a very strong networking communities and staff going out and radio materials and agricultural extension, could it be relatively easy to tack on some extra elements to promote also some production or even just consumption of other foods that would complement that orange/sweet potato? So they were interested in definitely behaviour change communication as an add-on and possibly also supporting home gardens. So the decision to make was what foods should they include there. So their objectives were defined. They then would go through and select criteria to match that. And in the end, there's 8 criteria that have been selected to align with these decision objectives. Hopefully this will show up, that's a bit clearer. So the criteria for this particular analysis that you'll be working with is potential of achieving nutritional adequacy with these foods, extent to which the food is already consumed locally, whether there's good availability of inputs needed for producing these different foods locally, whether there's any implications for women's workload intensity, so if particular products would need a lot more effort, relatively speaking, for women. Relative, definitely not a sort of numerical figure, but relative income potential from some of these different foods, knowing that as an agriculture program, that's one of their first goals, but also for people to pick up and start growing these foods or producing them, that might make a particular behaviour more attractive to them. And then whether this is in northern Mozambique where it's very dry and there's a lot of food insecurity, definitely making sure that it was appropriate for the water and pest situation and the temperature situation. And one other thing here, the reason that they were really looking at production is that in this particular part of Mozambique, market access is very poor. When people can get to markets, the availability of foods on the market is also quite poor. There's a lot of non-perishable foods, but there's not as many fresh vegetables as you'd expect. So production was seen as a good intervention point there. So with 11 minutes to go, I'm going to ask people to, maybe if you two want to join this table, to take the role of 3 stakeholder groups. So one group is going to be the agricultural programmers, one group is going to be the nutritionists, and one group is going to represent smallholders themselves. And is there anyone that really wants to be any of those particular groups, or should I assign you? Yeah? Okay, so I'm going to say the agriculture programmers are here, the nutritionists are there, and representing smallholders is at the back of the room. What I'm going to give you, I've got a printout of the criteria that are in this particular analysis, but I've also cut them out, if that makes it easy for you to spread them out and rank them. And all you need to do is put them in order of how you think this particular stakeholder group would actually rank them. I did expect to have a bit longer for you to do this, so I do apologise. If you really can't decide by lunch, we can go into, not into lunch, we can come back and have a few more minutes of it. You might need a few minutes to read through, and then really don't think it has to be done quickly. You can discuss what it means. What we've got on the sheet, just to sort of explain to you, is a little bit more of an information of how we would calculate that input or where we would get the data from. And then you've got for each criteria, you've got a 5-point scale, actually a 6-point scale. We would never just put in 1, 2, 3, 4, or 5. We then have a slider to use in the software, but you can sort of see what value or what each of the sort of number points really refers to it. So if you think about the 1 to 5 as a sliding scale, that might help you understand a little bit about what the input is that you're referring to. So we can do that until lunch. So the big one is this, and then there's the smaller ones. Here's a guy. And there's the smaller cut-up ones. Thank you. And here's your small pieces. There's another list there if that helps as well. Hey. Oh, yeah, I've just been clean, I'll actually finish. Sure.
Yeah, they don't run the
It's kind of taken for granted will be working.
My last two, they are very
I think that the very like how much these communities are already like working with projects and being made aware. I think the second is important because if they will have the
I think that can be self-reflection. Because ultimately right now if it's from this library we don't consider it to be like what are the requirements to make out of it in terms of production and how much money we make. Because there are many examples where we see the people who are growing they don't consume themselves, but because they find more value in kind of selling it and then buying other things in it.
In fact, there's a lot of distribution criteria and still trying to best. That's what it's probably also because of the background. Like to me, working with indigenous groups, neglected and utilized, I'm not so much interested in how it is consumed now because my work is to bring back
Exactly.
things that
I think now these two look at the other these are very pushy. Because you're not then thinking that it's a very sensitive crop and there's great associated with pests or seasonality. Yeah. If they don't want at many times they don't want to end up having a cash crop which is very difficult to kind of manage. How do you rate this? 24?
Yeah. I'm not sure how much funds are available.
See, they are not aware of the climate shocks at all. They're like, okay, this is from our years of experience, this is how it is, and this crop contains this much water, X, Y, Z. Then there's a risk if there are higher risk of growth.
Oh, the water is again, that's one of the often the women going for the water. I think we need to do these things also like with men.
Separately and see and then
I think they have not thought about splitting. Yes,
that's something that's
that is not
exactly.
Oh, you don't have to put the numbers in. No, that was just to understand sort of where the figures come from. It's a little bit abstract.
Then I think women 6 can be implication of what you want to say. The 11th one.
Yeah, that's okay.
It's now like has to go.
11, we can show you some what the impact might be.
Yeah, 11 to 1 1.
That's easy then. That's fine.
And we can make this comment
It has to be highest to lowest. Yeah. Going. You've also got here if it's easier for you to kind of put them out instead of writing. Up to you.
The first 18 gets 7. So you're writing, okay? So the one gets the 8, 2 gets 7. 3 gets 6. 4 gets 1.
Like they might be.
19 gets 6. 5 gets 4. 11 is 3.
It's a claim.
What we would do?
I think that's it. Like as a program, we still need to think what is good for these people. If we can just afford. Although I didn't
Great. No, that's already been pre-filled, but I wanted just to make sure people understood kind of if they were. Sometimes it's a bit hard to know what that means if you're not knowing how it's going to be measured. So I thought I'd just provide that whole example. I know that there's always a big line for lunch, so if you want to rush to lunch, you're very welcome to. We can have a few more minutes once you come back to continue. I don't want to deprive you of nutrition. Thank you very much.